This is a tricky one. I will say, first off, I'm not a family therapist, so I only work with individuals. So I'm probably not the best person to answer this question. What I'll say is that when a child, when you say minor, I mean, that's usually 18 or under, depending how young the child is. A lot of times, if you're sending like a 4 or 5, 6-year-old to therapy, there's a lot of family work being done or parenting work being done, because so much of what the therapist is working on will need to be reinforced at home. So everyone sort of has to be in on the plan. I tend to think, and again, this is not based on my experience because I don't do that kind of work, but I would imagine as kids get a little bit older, family counseling may be appropriate depending on the situation and the players involved, in terms of maybe shifting or improving some of the dynamics in the family if those are becoming problematic. So it really depends on the situation. But for the friend, they could always, call a therapist and ask for a consult and like, here's what's going on. What would you recommend? And now also, you just want to, when you talk to a therapist and you're looking for something that's somewhat specialized, we're looking for a therapist either to work with our minor child or to work with our family. I'd want to know, what kind of experience do you have in that area? What percentage of your practice is focused on that area? Just to kind of, make sure that they've done this before, that this is something that they do regularly, and that you feel comfortable with them, which is always the number one thing. You need to feel like I'm in the right place, right? So checking in with your gut is, really super important. But yeah, those are the suggestions that I would have. So have your friend do a consult with a therapist and get some feedback.